My name is Matt and welcome to my sports injuries presentation, part 1. There are 5 common types of acute injuries, including muscle strains, ligament sprains, tendon tears, dislocated joints and fractured bones. The first one, muscle strains. A muscle strain is a twist, pull or tear of a muscle or tendon. These injuries mainly occur from either overstretching or the impact of a collision. They come in 3 grades. Grade 1 being minor, short-term injuries, Grade 2 in the middle, and Grade 3 being severe, long-term injuries. Signs of muscle strains include pain, muscle spasm, and loss of strength. Number 2, ligament sprains. A ligament sprain is a stretch or tear of a ligament. These injuries mainly occur from either overstretching or the impact of a collision. They also come in 3 grades. Grade 1 also being minor, short-term injuries. Grade 2 in the middle, and Grade 3 being severe, long-term injuries. Signs of sprains include tenderness and pain, inflammation or swelling, and the inability to move a limb or joint. The third one, tendon tears. A tendon tear is where the fibrous tissue connecting a muscle to a bone snaps, causing severe pain. Tendon tears are caused by either a collision or a fall. A sign of a tendon tear is either pain or weakness in that part of the body. The fourth one, dislocated joints. A dislocated joint is where the joint or a bone connecting the joint has been moved out of position and therefore dislocated. Dislocation is usually caused by the impact of a collision, or a fall which results in an awkward landing causing an unusual movement. Signs of a dislocation include loss of movement, pain, joint movement, and numbness around the area of the body. The last one, fractured bones. A fractured bone is where a bone has snapped or separated into 2 parts. Bone fractures are usually caused by the impact of a collision or occasionally a fall. A sign of a bone being fractured is severe pain, swelling, and in some cases, visibility of the bone. There are also 5 common types of chronic injuries. These include tennis elbow, golfer's elbow, shin splints, stress fracture, and tendonitis. Tennis elbow is a condition that causes pain around the outside of the elbow and is usually caused by strenuous exercise and overuse of the muscles surrounding the elbow. Signs of tennis elbow include pain when moving or lifting the elbow. Second one, golfer's elbow. Golfer's elbow is a condition that causes pain where the tendons in the elbow attach to the bone on the inside of the forearm. It is usually caused by an overuse of the elbow. Signs of golfer's elbow include pain and stiffness as well as weakness. Third one, shin splints. Shin splints is a condition that causes pain in the front of the leg due to extensive exercise. The main cause of shin splints is unknown. However, high activity levels increase the chances of it occurring. The sign of shin splints is usually pain, which affects both shins. Second last one. Stress fracture. Stress fracture is a fatigue-based injury which results in a bone fracture from a build-up of stress on a particular bone. The main cause of a stress fracture is the overuse and repetitive exercise, as well as a change in the usual activity levels. The main symptom of a stress fracture is reoccurring pain in a certain part of the body. The final one is tendonitis. Tendonitis is a condition which occurs shortly after an injury to a tendon. The main cause of tendonitis is a repetition of pressure on a particular tendon. Signs of tendonitis include pain in a tendon as well as difficulty moving that tendon. That is the end of part 1.